Hi, everybody. I'm here to give an update to the ABCD demographic, physical, and mental health assessments since my previous ReproNim presentation only covered up through year 4, and we've added and changed some things since then. We're actually already through working on year 8 assessment and planning year 9. Let me start with the case ads. So we have continued to administer the case ads to both youth and their parents at almost every wave. There are a number of modules that we've continued to administer every other year and plan on doing so through year 9. That includes mood disorders, social anxiety, generalized anxiety. We did add in obsessive compulsive disorder in year 6 and continuing into year 8. We started eating disorders in year 2, doing that every other year. We added in conduct disorder, including measures of callous and unemotional traits, doing that every other year. We've continued to ask about sleep problems and suicidality. One thing to note about suicidality is that in year 5, we stopped asking about past suicidality because youth reported it was time consuming, distressing, repetitive. We continue to ask about alcohol use and drug use disorders. In the early years, those modules were only triggered if the youth drank or used enough substances. In the later years, as I'm sure they're talking about in the substance abuse module, we are administering those to everybody. In terms of the parent report, we continue to administer a number of modules from the parent. That includes, again, mostly every other year because of time constraints. So that includes mood disorders, psychosis, panic disorder, agoraphobia, social anxiety disorder, generalized anxiety disorder. You can see the list here. It includes eating disorders, ADHD, ODD, conduct disorder. The things we did stop doing in the later years was no longer asking the parents about alcohol and substance use disorders starting in year 7, um, because we felt that those were better reported on by the youth. And we also stopped asking about PTSD because we did start asking about PTSD from the youth themselves once they turned 16. So, a lot of continuity in the assessments over the different years, but also some changes as well. Just a few things to note about scoring and QC issues. So, we had a lot of issues with the diagnoses in the 4.0 release having to do with the KSADS group itself. We worked with them to fix those, and we did release many fixed diagnoses in release 5.1, except for eating disorders and ODD, which needed some continued work on addressing accurate diagnoses. We did work with a number of experts in the consortium on this, and we have updated those diagnoses, and those were released in Release 6.0. Uh, just a reminder that the autism-like diagnoses weren't valid in KSADS 1.0, and they were improved in 2.0. And similarly, the psychosis diagnoses weren't valid in 1.0 and were improved in 2.0. There was an accidental non-administration of ODD in year 4. That's not recoverable data. And we are actually further updating or adding additional eating disorders diagnoses based on a collaboration with experts in the ABCD to get some more fine-grained diagnoses in there as well. Also to note that there was a change in past ADHD diagnoses from KSADS 1.0 to 2.0. So in 2.0, there's now a in full remission if they're taking medication and no longer have symptoms, and that could replace past ADHD for a lot of youth. It's also important to note that the partial remission criteria changed from 1.0 to 2.0. In 1.0, you needed 2 current symptoms to get in remission, partial remission. And in 2.0, you only need 1. So you'll note when you look at the data that there actually is a shift to a reduction in the number of past ADHD diagnoses to an increase in the number of partial remission diagnoses that we think reflect that change in criteria. Also want to note that we have harmonized 1.0 and 2.0 for diagnoses and symptoms in the most recent 6.0 release. They were previously released as two separate data structures, and now they're integrated. We have not yet released items. We will in 7.0 because we're working on that same harmonization. And also to note that we stopped, I said this already, asking about past suicide in year 5. We continue to do dimensional measurements of mental health, and many of those have continued on. So we do prodromal psychosis every year. We continue to do mania every other year. We stopped doing the brief problem monitor year 5 and started doing the youth self-report, and we will be switching to the adult self-report for youth when they are 19 and older. We continued to do the toolbox positive items every other year through year 7. We will be adding a PTSD checklist in year 9. And I also want to note that we discontinued the brief delinquency measure. It had some issues and problems, and this was when we updated the conduct disorder diagnosis in case ads to include callous and unemotional traits. From the parents, we continued to get adult self-report measures a number of the years on the parents, skipping some years for timeliness. And then we also got the adult behavior checklist on the other parent in years 2 and 4. We continue to get the CBCL on the youth from the parent every year. We'll continue that through year 9, although we will switch to the adult behavior checklists when the youth are 19 plus. So that'll be parent reporting on the youth. We redid family history in year 6, so that will be updated information. We continue to ask about mania from the parent perspective through year 8, skipping year 3 for time. We won't do that in year 9. And we added in a parent report of their own perceived stress in years 3 and 6, and again in year 8. And we repeated the short social responsiveness scale at year 5 and year 7, and we hope to do it again at year 9. And then we continue to get the brief problem monitor from the teacher as long as the youth is still in secondary school. We won't continue when the youth starts college, obviously. So continuity of a lot of mental health measures. We also continue to ask about personality and other behaviors. We From the youth perspective, we continue to ask the BIS-BAS every other year up through year 6, and the same thing with the UPS, the impulsivity measure. We discontinued at year 6 for time and because we thought we had a lot of stability of the measures. We have been asking about emotion regulation years 3 through 6, and then again in 8. And again, I noted that we discontinued the brief delinquency measure. We do plan on adding a perceived rejection measure in year 9. From the parent and we also added in a personality measure for the youth to report on themselves in year 8. And we hope to get the parent to give that report in year 9. And then we also asked parents about emotion regulation for youth in years 3 through 8. We did not repeat the temperament questionnaire again, but that is why we are trying to get the personality measure in year 9. We also continue to get measures of stress, life events, and friendship. So a lot of continuity there. We continue to ask about cyberbullying, life events from both youth and parent report perspective, peer experiences, numbers of friends. The new things that are being added in year 9 are that we will get the childhood trauma questionnaire, the CTQ, from youth in year 9. And we will also get the questionnaire of unpredictability in childhood, the short quick. So those will be new measures that will be coming when we get to year 9. But otherwise, a lot of continuity across the waves in these other measures. In terms of physical health, I'll focus first on measures from the youth. Lots of things that have just continued, anthropomorphics, measures of sleep and chronotype, nutrition, puberty, physical activity. Some things to note that changed or were added. So we did discontinue the COVID assessment form. We will have started asking youth about their own medical history and medications starting in these later years here. And we also started asking youth about sports activity involvement and their sexual behavior. That had already started. We do continue to get pubertal hormones, pubertal development scale. So lots of continuity in those physical health measures from the youth perspective across the years, with some adding in of asking youth directly about things themselves that we previously only asked parents about. When we look at parent measures of physical health, again, a lot of continuity through year 5, but we did discontinue a number of things. So the things that have continued and will continue are parent reported medical history and medications and traumatic brain injury. The things we are discontinuing is we didn't try to get baby teeth past year 5. Um, Obviously discontinued the COVID form. We're not asking parents about the menstrual cycle after year 7. And we don't ask about puberty or sleep disturbances from the parent after year 6. And we no longer ask the parent about sports involvement after year 4. So, some things that have continued, but some things that have changed and to some extent shifted to asking directly from the youth rather than the parent. We also continue to get extensive assessments of demographics. So we continue to have sex, race, and ethnicity, country of origin, family income, although we have moved to asking many more questions about youth's own income, parental occupation, family structure, family financial adversity. We still have the baseline measures of neighborhood adversity, but we do plan to release more detailed measures as the youth have moved over the years, hopefully in 7.0. And as the kids are getting older, we ask more about the kids' education and vocational status. So obviously, we'll be asking measures about them moving to college. But as the kids start to have jobs, we're asking a lot of measures about their job, questions about their jobs and their own income streams, um, try to capture that shift in demographics. All right, so those are the major updates in these domains. Always happy to answer any questions. Feel free to email me or, folks in our work group if you have questions. But I hope you continue to find the ABCD data useful and let us know if you have any questions. Thank you.